The FAA reviewed the files of close to 5,000 veterans as of this summer, grounding about 60 while they, quote, reconcile their records. Kevin Voorhees flies planes for a living.
My transition out of the Navy into civilian life was difficult.
Well, he used to.
2010 to 2012, and for a short time in 2014, I decided to go get some counseling.
Diagnosed at the time with depression, anxiety, and insomnia, but he says the counseling was successful.
I haven't had any treatments, symptoms, anything since then.
Fast forward to last summer, after a couple of years as a commercial airline pilot.
I got a letter from the FAA along with 4,800 other veterans saying there's discrepancies between your VA medical and your FAA medical.
The VA and FAA have been cross-checking medical records, noting some veterans working as pilots were receiving VA benefits for conditions they did not disclose to the FAA. It's part of an overall push to address potential underlying mental health issues and ultimately passenger safety. In October, an off-duty Alaska airline pilot made headlines after he tried to shut down a plane engine mid-flight during what he said was a nervous breakdown. But Voorhees says the root issue is the current system itself, one that encourages a culture of secrecy or ignoring mental health care altogether to protect livelihoods.
It's well documented. There's a lot of people who have gone, they've grounded themselves, and they go to counseling. They go through the proper avenues, report it to the FAA, and the FAA just goes into a black hole. And again, they're grounded for years.
Not to mention money and time spent seeing FAA-approved specialists. The FAA lists these conditions as potentially disqualifying and also notes other conditions not specifically listed in the regulations are also disqualifying.
Mental health is really what's in the headlines right now, but it's really the whole aeromedical system at the FAA currently.
The mental health conversation has really taken off in recent months. A DOT Office of Inspector General report in July found that the agency's ability to mitigate safety risks is limited by pilots' reluctance to disclose mental health conditions. On February 7th, the bipartisan group of lawmakers sent a letter encouraging the FAA to modernize its mental health protocols. In December, FAA Administrator Michael Whitaker established a new committee to tackle the issue, an issue he addressed during a February 6th Senate subcommittee hearing.
I think it's long overdue to update the approach to mental health and just treat these as health issues and have a clear path to treatment and get people back in the cockpit as quickly as possible.
Voorhees hopes there is follow-through to improve what he calls an antiquated and cumbersome system.
They need to change the culture to encourage pilots to get mental health treatment. A system where if you need to ground yourself for mental health issues, get counseling, that getting back to the cockpit is a lot more efficient.
As he plays a waiting game on the ground due to years-old medical records.
There's a pilot shortage, and they're discouraging other pilots from even getting into the industry.
Voorhees did pass a recent psych evaluation, but is still working with the FAA. He plans to attend a pilot mental health advocacy day in D.C. in March.